This is Dr. Caroline Peterson from Natural Women's Health Institute in Sarasota, Florida. And today we're going to talk about natural care for pelvic congestion. So, pelvic congestion syndrome is a particular diagnosis that's based on certain criteria that need to be met in order for a diagnosis of pelvic congestion syndrome to be reached. A person can have pelvic congestion even if they might not have had the diagnostics to confirm that they have pelvic congestion syndrome, or if they have the diagnostics and they don't quite meet the parameters, they can still be experiencing a functional type of pelvic congestion that can also be related to pain and dysfunction, even if they haven't met the diagnostic criteria for pelvic congestion syndrome. Pelvic congestion syndrome means that either the ovarian vein or the testicular vein is dilated, and that there are varicose veins or varicosities, varices that are around the uterus. This can be accompanied by varicosities of the external genitalia, which is called the vulva in women or the scrotum in men. And also in men, it can also be testicular varicosities. And sometimes there is venous insufficiency of the legs. And then the big thing is that you have pain. You have pelvic pain for at least 6 months duration. This is most common in women, particularly premenopausal women who've had multiple pregnancies, women who are obese, men who have pelvic varicose veins. This is sometimes related to the prostate enlargement. It can be related to other things also. 40% of women with pelvic venous insufficiency or pelvic congestion also have polycystic ovaries. And so that's something that we have to always keep in the back of our mind, because in order to have a resolution of pelvic congestion syndrome, if a woman has polycystic ovaries, we would need to also address the polycystic ovaries, treat those, and help the woman heal from that, which is generally due to insulin resistance. Symptoms of pelvic congestion syndrome include pelvic pain, like we were talking about before, of at least 6 months duration, swelling of the lower extremities, tenderness, cramping, and heaviness of the abdomen and the pelvis. This pain that's due to venous insufficiency, varicosities, and inadequate functioning of the venous return system is always worse with standing and walking. And that's because the veins are asked to work harder if you're standing, because they're working against gravity. And if you're walking, you're causing the blood to circulate more. And so then the veins are not only working against gravity, but they're also having to work faster to bring that blood back to the heart for reoxygenation. This swelling of the thighs, legs, and ankles or feet, of course, is related to the venous system, but also related to the interstitial system, because at the capillary, the arterial blood is split out into direct venous return interstitial fluid that goes into the tissue and then is returned through the lymphatic system. And so, a lot of times, what I find is that when there is a slowing of the venous system return, then we're going to have a lot of bogginess in the tissue, which is the interstitial fluid is not getting pulled back into recirculation. And so that's usually, in my experience, a big part of the swelling is actually the interstitial fluid, which is related not only to the venous system, but to the lymphatic system. There's pain in the pelvis during and particularly after sex. And this is because sex is has to do a lot with the vascular system for engorgement of the tissue. And then a lot of times people will feel worse after sex because the problem isn't bringing blood into the pelvis through the arterial system, but it's a problem getting it out through the venous system. So this is a very stereotypical finding. Sometimes people will also have varicose veins on the external genitalia. So in females, that's going to be the vulva, which includes the labia. Sometimes it will also be the upper thigh and the buttock that have varicose veins. In men, the varicose veins can be on the testicles, the scrotum, the thighs, the buttocks also. The discomfort can also be related to the bladder and the rectum. And of course, this is just because the bladder and the rectum are also drained by the pelvic veins. And so, dependent on where the compromise is, then there can be bladder and rectum involvement. Menstruation can commonly be painful because there's more blood, there's more inflammation during menstruation, and so this kind of inflames the area. There's more congestion because there's more volume in the area that's moving, needing to move. And so for multiple reasons, pelvic congestion syndrome can be worse during menstruation and sometimes also worse during ovulation. The number one best diagnostic symptom for pelvic congestion syndrome is actually pain after sex or ovarian point tenderness. That is very sensitive and quite specific for being pelvic congestion syndrome for the reasons that I pointed out before, which is sex requires blood to flood into the pelvis. And then after sex, if you don't have a good venous return, that's all that extra blood is just going to hang out in the pelvis and feel very, very bad. The differential diagnoses for pelvic congestion syndrome are endometriosis, which we can understand shares quite a few of the same symptoms. However, endometriosis is not an issue of the venous system. It's an issue of having endometrial tissue outside of the uterus. And so you'll see some of the timing be similar to the pain, and the endometrial tissue can get into the bladder and the rectum and lots of different areas. And so you can have similar pain patterns to that. But again, endometriosis is not related to the venous system. Adenomyosis. Adenomyosis is also Differential diagnoses for pelvic congestion syndrome include endometriosis. Endometriosis is not a venous problem like pelvic congestion syndrome is. Endometriosis is when the endometrium, which is the lining of the uterus, grows outside of the uterus. And so then you're having an endometrial response, like a period, outside of the uterus. And it can be anywhere. It can be the bladder, it can be the intestines, it can be the rectum. And so you can have similar pain patterns to pelvic congestion syndrome. As far as timing is concerned, worse with the menses, for instance. But again, they have a different reason for occurring. Adenomyosis is when the endometrial tissue becomes implanted into the muscle of the uterus, and this causes heavy bleeding and pain with the period. And so again, this is a pain syndrome that's related to the pelvis, but not related to the venous system. Similarly, fibroids are non-cancerous tumors in the uterus, and they can lead to heavy bleeding and pain, and again, are not related to the venous system, but they can cause pelvic pain. Musculoskeletal disorders also, of course, can involve the pelvis, the sacroiliac joints, and the low back. If these issues, if you have musculoskeletal pain that is not related to a new injury, if you have musculoskeletal pain in the pelvis or the low back that does not respond to typical treatment with chiropractic, acupuncture, and massage, then this is not true musculoskeletal pain of musculoskeletal origin and probably has a visceral or vascular component to it. Irritable bowel syndrome can also cause pain in the pelvis and is the number one reason that for an incorrect hysterectomy procedure. Hysterectomies are given primarily for pelvic congestion syndrome. And so if you have symptoms of pelvic congestion syndrome that do not respond with removal of the uterus, then one of the things you could have is irritable bowel syndrome, sadly. So irritable bowel syndrome is, of course, not a venous issue. It is a digestion and inflammatory issue that needs to be treated with diet and other kinds of nutritional intervention that we can do in natural medicine. Painful bladder syndrome is related sometimes to interstitial cystitis. Painful bladder syndrome means pain in the bladder. Usually in that diagnosis, there's no change to the actual cells in the bladder. But with interstitial cystitis, there are inflammatory changes to the cells of the bladder. Psychological factors for pelvic congestion syndrome or pain, not for pelvic congestion syndrome, but for pelvic pain. Psychological factors, so this includes a lot of times a history of assault, rape, shaming, different hurtful, emotional, and physical assaults. Pelvic inflammatory disease is usually caused by a sexually transmitted disease that then causes inflammation and adhesions in the pelvis if not caught early. If it's caught early, then that would be treated with the appropriate intervention for that STI. If it is not caught for a long time and not treated for a long time, then the inflammation of the sexually transmitted infection will cause adhesions in the pelvic organs, the pelvis. And so then you will have to deal with not only treating the infection, but also healing the adhesions. Chronic pelvic pain accounts for up to 20% of all gynecological consultations. 10% of all women have ovarian varices, and 60% of women with ovarian varices have pelvic congestion syndrome. So that's another high predictor of pelvic congestion syndrome. Ovarian vein varicosities or incompetence, particularly on the left. Other risk factors are being premenopausal and having had multiple babies. 30%, almost a third of chronic pelvic pain is caused by pelvic congestion syndrome, which again is a venous system syndrome. The blood is not able to move out of the pelvis well enough. So the ovarian vein and the iliac vein are the two most important veins for draining the pelvis. And if there's incompetence in either or both of these, then there will be a probability of developing the pelvic congestion. The veins have little valves in them that open and close, and that's the way they move the blood back up to the heart so that it can become oxygenated again. The muscles help some with this, but then the valves are primarily responsible for moving the blood back up to the heart. In a varicose vein, the valves are not functioning properly, and so they don't do a good job of moving the blood back up to the heart. Some of the reasons for problems in the pelvic veins can be related to hormones, so that they're more relaxed. For instance, the valves are more relaxed with progesterone. There can also be valve insufficiency, something that perhaps a person was born with or has developed over time due to obesity or injuries and things like that. There can also be obstruction of the venous system that makes it difficult for the blood to return out of the pelvis. This obstruction could be mechanical. For instance, an organ that is not in its proper position, moving correctly, or it could be related to adhesions, a prior surgery, can be also related to incorrect breathing patterns, incorrect posture, and things like that, insufficient muscularization or activation of the muscles. All of those things can be contributing factors. When we look at pelvic congestion, and the places that biomedicine recognizes um, are the key areas to look for the problem. As I mentioned before, the number one place is the left renal vein, into which the left ovarian vein or testicular vein is going to drain. So the renal vein, you can see in this picture. Well, this is not a good picture to show that. The renal vein has to cross over the whole one left side of the abdomen and the aorta in order to get to the abdominal vena cava. And so it's a lot of space and effort to get over that aorta. So there can be compromise there. And you can see that the left ovarian or testicular vein, the left gonadal vein, is going to drain directly into the left renal vein. So if there's an issue with the left renal vein, then we're going to have an issue with the left ovarian vein, which is one of the main drains out of the pelvis. So that's why in the Barral technique, we always say left kidney is the reproductive kidney, because if it's not moving properly, then we're more likely to have a reproductive issue or an issue with the pelvis than if the right kidney is involved. You can see the right ovarian vein drains directly in 90% of women into the abdominal vena cava. And so this is an easier route. The angle is better, and there's no sort of potential compromise due to changes in the kidney. So we say the right kidney is the digestive kidney, so it's more likely to create digestive problems if people have a movement issue with the right kidney. So the second region that creates pelvic congestion syndrome is the gonadal veins, the ovarian or testicular veins, like we were just talking about, or also the internal iliac vein. So this here is the abdominal vena cava. It splits off around the belly button area into the common iliac veins, left and right. And then they split off into the internal and the external iliac veins, left and right. The internal iliac vein is for draining the pelvis. The external iliac vein is for draining the lower extremities. And so this is the second region where we see problems related to pelvic congestion. The pelvis itself can be an area where there's obstruction of venous return. And so this would be the actual veins in the pelvis, and they would need to be addressed themselves. And then the lower extremity. If the lower extremity is not draining properly, then you'll have the upper thigh varicosities. And what will try to happen is the pelvis will try to help out by draining the lower extremity, since for whatever reason, the external iliac vein might not be functioning up to par. And so then that compromises the pelvic drainage itself, because everybody wants to help. So again, here's a better picture of the left renal vein showing the abdominal aorta and how the left renal vein typically passes under the superior mesenteric artery. And sometimes there can be compromise here related to adhesions. It could be related to obesity, to lack of musculature. It could be related even to plaquing and things like that. It can be related to ptosis or falling down of the kidney so that you're changing the angles of the venous return, and that creates a compromise in itself. So this is an extra challenge on the left side, like we were talking about before. The ovarian veins and also the testicular veins um, are in part responsible for draining the pelvis. In women, the ovarian veins drain the broad ligament, which is a ligament of the uterus, the fallopian tube, the uterine fundus, venous plexus. So it's like a network of veins at the top of the uterus. All of that is drained by the ovarian veins. So it's not just the ovary that the ovarian veins drain. As we mentioned before, the left ovarian vein drains into the left renal or kidney vein, and 43% of women have incompetent valves of this left ovarian vein. And so because that vein already, has a lot of demands placed on it, then sometimes adding a little bit of compromise to the system on top of what's already there will kind of be a little bit too much. And so that again can be something like adhesions. It can be something like ptosis of the kidney, a kidney that's not moving properly, so you don't have the correct angle of the ovarian vein draining into the renal vein, for instance. So these are things that visceral and vascular manipulation can help with. As I mentioned before, the right ovarian vein in 90% of women drains directly into the inferior or abdominal vena cava. And almost as many women are likely to have incompetence of the right ovarian vein. But because it's an easier passageway getting back into the vena cava, the right side is less commonly impacted than the left side for incompetence or in relationship to pelvic congestion syndrome. So this shows you the utero venous system in the fundus here. So this little network, I don't know how to make that thing go away. And how the ovarian veins are what help to drain the top or the fundus of the uterus. And then the internal iliac veins are more responsible for draining the lower part of the uterus. So that internal iliac vein not only drains the lower part of the uterus, it also drains the vagina, the bladder, the clitoris, the labia, the inferior rectal veins, and the gluteal veins, and then those rectal veins, not the superior, but the middle and inferior will go into that uterovaginal plexus. So that's another place it could get caught up. So here we have the internal iliac vein. Here's the internal iliac vein that branches off the common iliac vein, as does the external iliac vein. The internal iliac vein is going to drain the superior gluteal vein through the greater sciatic foramina, the inferior gluteal vein, and internal pudendal vein through the lesser sciatic foramina, the rectal venous plexus, the vaginal venous plexus, the vesicle or bladder plexus, and then the obturator vein through the obturator foramina. very, very busy. The external iliac vein drains the lower extremity and the external genitalia, the mons pubis, and the inferior abdominal wall. So it is not as directly related to pelvic congestion syndrome as the internal iliac vein, but it definitely can play a role. So when we're talking about vulvar varicosities, then we're talking more about the external iliac vein, which drains the femoral vein and the greater saphenous vein, and then this external pudendal vein, which is what is draining the clitoris, the labia, and in men, the penis and the scrotum. So the the workup for pelvic congestion syndrome could include laparoscopic assessment, which is surgery on your back. And so this is not the preferred way of doing it because, of course, it's very invasive. And also not super awesome because you're laying down and the whole belly is inflated. So you can get a false negative with this. Um, the the ultrasounds, transvaginal or transabdominal, can not only take the picture, but they can also measure flow of the blood. So this is a less invasive way of determining if there's compromise of the venous system. We also have magnetic resonance venography, in addition to the standard MRIs and CTs. The gold standard is still venography, but again, it is invasive and oftentimes not performed. So the ultrasound is a nice option. So with ultrasound, what they're looking for, um, when they check for these things, what they will do is have you take a deep breath in, hold it, and bear down like you have to go to the bathroom, but don't really do that when you have to go to the bathroom. That's called Valsalva's maneuver. And so what they're looking for are tortuous pelvic veins, and that means crooked pelvic veins at least 6 millimeters in diameter. They're looking for the blood to be slow, and they're looking for the veins of the uterus and the pelvis to be distended. And then because PCOS, polycystic ovarian syndrome, is so commonly associated with pelvic congestion syndrome, they're also looking for changes in the ovaries, polycystic changes. So this is a picture of the arcuate veins. Here's the endometrium, and these little coiling blue things are the arcuate veins that then would help to drain that endometrium. If you do a CT, they're looking for a distension of the ovarian vein and also the tortuous or the crooked uterine veins. And as I mentioned, the venography is the gold standard, but it's very invasive. And that again is looking for a distension of the ovarian veins and retrograde flow of the veins. So they go in backwards. So they would go, away from the heart instead of towards the heart, like a vein is supposed to. So the valves aren't working. And then some twisted or crooked pelvic veins, and the dye that they use would not move through the veins as quickly as they expect. So in biomedicine, the treatment is usually not medication, but they'll do a clipping of the ovarian vein or take out the hysterectomy and take out the ovaries. In up to 33% of cases, the hysterectomy is not effective. Other things they'll do is to treat the veins with a coil, embolization, plugs, or sclerotherapy to basically close it off. The best treatment is considered to be embolization, but there is no randomized control trial to assess the effectiveness of this intervention. In natural medicine, what we want to do is to look at what is the underlying cause. So, for instance, if the woman has polycystic ovaries, then we want to address what's going on there, whether it's diet, whether it's working with helping the body to regulate fuel better and improve cellular sensitivity to insulin, if it's working with diet, if it's working with exercise, detoxing, things like that. We also want to make sure that all of the organs are in place and moving properly, and that the veins are not adhesed anywhere and can drain as well as they can. And that the lymphatic system and the interstitial fluid is draining as well as it can. One of the passive interventions that's helpful for hemorrhoids, which is one of the things that can be caused by pelvic congestion syndrome, is called the Kesey technique. And that is electric ablation of hemorrhoids, so that they don't exist anymore. And so this is an outpatient procedure that you can get in Portland, Oregon. And there's the link. So visceral manipulation is one of the big things that I do for pelvic congestion syndrome. And that includes working with the organs so that they're moving properly and they're helping the veins to drain. I also work with vascular manipulation, so that's venous drainage, helping the veins to drain and rehabilitate so they can pull up blood out of the pelvis. Lymphatic and interstitial fluid drainage are also essential. To maintain movement in the fluid systems of the body, we have to have correct breathing, which means that the lungs inflate in the rib cage. The rib cage expands 2 inches every 3 seconds. Over the course of 3 seconds. And then the respiratory diaphragm presses down to displace the abdominal organs and the pelvic floor. Then when we breathe out, we have a slow breath out for 7 seconds, and the diaphragms return to their normal position. And so we're having 6 breaths a minute. So it's slow breathing with core engagement. So you're not doing Buddha belly breathing or baby belly breathing, pooching out your stomach. This is going to make a problem for vascular drainage if you breathe like that. And so we spend a lot of time with core strength training and proper breathing, proper engagement of the musculature, pelvic floor, and so forth, because this is imperative, especially if there is compromise in the venous system. In the venous system, we have the valvular venous system and the non-valvular venous system. The non-valvular venous system, like Bateson's plexus, is dependent on the breath to move the blood. And so if we have compromise of the valves in the valvular venous system, then we really have to have core engagement and correct breathing to optimize movement of the blood. So of course, not everyone responds to conservative management. And so sometimes a consultation with a vascular surgeon is necessary. Sometimes some people don't want to do the work of retraining the body to breathe correctly and to exercise and become strong. So they may also benefit from a consultation with a vascular surgeon. So hemorrhoids are one of the things that can be painful and contributory to pelvic congestion syndrome. Of course, eating more fruits and vegetables is helpful. Basically, what we're talking about is don't be constipated. You don't want to hang out on the toilet. Believe it or not, poop is supposed to come out easily. It's supposed to be formed. And so if you eat adequate fruits and vegetables and you drink a lot of water, that's a good start. Using the squatty potty. I'm not saying that's, cures for everybody. I'm just saying we all need that nutrition. And so that's a good place to start. Of course, there's a lot of other reasons that people could be constipated, but if we get the basics in place, then that's a good place to start. You don't want to bear down when you're trying to have a bowel movement. And so it's better to blow out than hold your breath and bear down. You don't want to do that. These are some suppositories for hemorrhoids that are super helpful. They're homeopathic. You can get those on the internet. You can also get witch hazel or Tux at the grocery store to help with the more distal hemorrhoids, ones that are close to the opening. Be sure you don't wipe too much. You can use a peri-wash or bidet water instead of wiping, and that will be really helpful for the delicate tissue around the anus. We do want to see at least one bowel movement a day. Ideally, we want to see 3 formed bowel movements a day. And walking, of course, will help stooling also. Many times people are not going to be able to recover the health of their venous system without turning to plants for support. And so I will put most people on a supplement called Vessel Forte by Designs for Health, which is very good at strengthening the vessels and helping drain the venous system and the lymphatic system and decrease inflammation. I'll also put people on something like lumbrokinase to break up clots, because when we have slowed venous returns, then we're going to have a tendency to get clotty, and we don't want that. And then fish oil is one of the best things for helping the blood be slippery, and that also decreases inflammation. One of the other things that you can do, an old-fashioned thing that was used for pelvic congestion syndrome in the olden days, is something that's called a sitz bath. A sitz bath actually requires 2 basins. So one basin like this, and then I'll usually have people use the bathtub as the other one. This one here they would get cold water in there and a bunch of ice. So get it as cold as possible. And then the bathtub, you're going to get as warm as you can stand. You do not want to hurt yourself, but these should be the extremes in cold and hot that your body can tolerate without being injured. To do the sitz bath, you start in the cold water for 30 seconds, mid thigh to the belly button. You get out, you get into the hot water or very warm water in the bathtub for 60 seconds, 60 seconds. And that also is mid thigh to just below the belly button. And then you end with 30 more seconds in the sitz bath. And so, what sitz baths do is they create a pumping action in the pelvis so that you can, it creates tone in the veins and it helps to get the blood out of the pelvis. And so, if you do this, at least once. The first time is the most important time because it can be a reset. But you could also do it, once or twice a week, and that can also help. I usually won't recommend it until we've gotten some of the other infrastructure in place in the body, so that the sitz bath can be maximally beneficial when it's actually done because it's kind of like a pain and it is very jarring for the body. But it also can be life changing. And so it's a tool that we have that can be used, should be used appropriately. Sitz bath. So I recommend considering conservative management for pelvic congestion syndrome if you're a person who wants to make changes in your life, and enter more deeply into your body and heal some of the underlying situations that may have contributed to the pelvic congestion syndrome. And so, of course, like we mentioned before, the visceral and vascular manipulation are part of it. The body, especially the pelvis, is going to be holding a lot of emotions. So, very commonly, there's going to be an emotional component, an energetic component that's related to this. Very commonly, I would say all the time, there's a lymphatic component. Generally, we'll have a nutritional or botanical support that's going to be helpful for clearing things out. And then the thing that people really seem to have the hardest time with is retraining the breath and the core engagement. So that just takes a little time and persistence. And so it's hard because usually the people who have pelvic congestion syndrome are the people who are very, very busy. They have very many kids and they have a household to run. They have work to do, lots and lots of running around, things to take care of. And so it's hard to set aside the time, not only for the passive care, like the visceral and vascular manipulation, but then for the exercises. And so, but the exercises are really what make it stick. And then the sitz bath would be an example of the hydrotherapy. We also had the Kizzy technique for the hemorrhoids. Um, so it's a journey to have pelvic congestion syndrome, and it's largely unspoken. And I'm here to help you when the time is right for you.